Good morning, Mr. Davis. How are you?
I'm good. How are you?
I'm good. My name's Jennifer. I'm a nurse practitioner student, and I'm going to be performing a head-to-toe physical exam.
Okay.
If you have any questions along the way, go ahead and just let me know. If you have any discomfort, we'll go ahead and modify.
Okay.
Okay, so I'm going to wash my hands and then get started. So I would wash my hands. Now the first thing I'm going to do is do a general survey on the patient. So I'm looking at the patient. He doesn't look like he's in any obvious distress. He is dressed appropriately for the exam, and he looks well nourished, healthy. So the first thing I'm going to do, I'm going to inspect and palpate his scalp and skull. So I'm looking at his scalp. There are no lesions, no rashes, no obvious deformities. I'm going to go ahead and palpate the skull. And it's normal cephalic. I'm looking at his hair. His hair is evenly distributed. It's shiny, smooth. There are no dandruff on the scalp, no lice. Okay. The next thing we're going to do is we're going to palpate your facial bones. Tell me if you have any tenderness. Anything hurt?
Nope.
Okay. I'm also going to palpate the sinuses, the frontal sinuses. Any pain?
No.
Any pain?
No.
Okay. And then the next thing we're going to do, we're going to look at the symmetry of the face, eyes, and ears. So his eyes are symmetrical. His ears are symmetrical. They're aligned with the outer campus of his eyes. And his nose is symmetrical. The next thing we're going to do is look at the skin on his face. Again, his skin is pink, it's warm and dry. There are no lesions, no rashes. The next thing we're going to do, we're going to go ahead and check the patient's eyes. So when we're inspecting the eyelids, there is no ptosis, no drooping. We're going to look at the conjunctiva. We're going to pull down the lower eyelid. It's pink, there's no drainage. We're also examining the eyelashes. And they have even distribution of hair, no cresting, no drainage. And his eyebrows are evenly filled in with hair. They're evenly distributed with hair. And the next thing we're going to do is we're going to go ahead and look at the sclera and the cornea and the iris. So just look at me for a second. And his sclera is white. There is no jaundice. His iris is evenly pigmented and round. And his cornea is clear. There's no scratches, no obvious injuries. And the next thing we're going to do is we're going to go ahead and grab the pen light. We're going to inspect his pupils, make sure they're parallel. So go ahead and look at my pen light. His pupils are equal, round, and reactive to light. We're going to have you stare at this pen and just follow the pen light in. Okay, good. So his pupils, his pupils converge and constrict, so they also accommodate. And the next thing we're going to do is we're going to go ahead and do the fundoscopic exam of your eyes. So I'm going to be examining for the optic disc. So if you just go ahead and look straight on. Okay, so I was able to visualize the optic disc. I would also be checking the other eye. The optic disc has clear margins. It's light yellow in color. There is no blurring of the margins. The next thing we're going to do, we're going to go ahead and assess for the red reflex. So go ahead and look straight ahead. Look at the wall in front of you. Okay, so I was able to see the red reflex in both pupils. It is symmetrical, and it's not pale. It's evenly reddish orange. And the next thing we're going to do is we're going to look at the corneal light reflex. So I want you just to go ahead and stare at my nose. Okay, so I'm able to see the light reflection. It is in both pupils, and it's even, the same in both pupils. It's symmetrical. So we're going to check for confrontation now. So I'm going to have you cover your right eye. I'm going to cover my left eye, and I'm going to ask you to tell me when you see my fingers.
Okay. Right. No.
Okay, good. And then cover your right eye with your right hand. I'm going to cover my right eye with my right hand. Tell me when you see my fingers. Look straight ahead. Good.
Okay. Okay.
Good.
Okay.
Okay, so we tested for the peripheral vision, and that is intact. We're going to also do the cover uncover test. So I'm going to have you cover your left eye now with your, yep, that's fine. And then uncover it. Just look straight ahead. Cover it again. Look straight ahead. Uncover, I'm sorry. Good. Now do to the opposite eye. Uncover. And do it again. Keep looking straight ahead and uncover. Good. So we're looking for any nystagmus, and none was noted. Now we're going to check the cranial nerves 3, 4, and 6, and we're going to be checking the cardinal fields of gaze. So I'm going to have you look at my pen light and just follow the pen light with only your eyes. Good. 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 So that's also checking the extraocular muscles, and cranial nerves 3, 4, and 6 are intact. The next thing we're going to be looking at, we're going to be checking the ears. So the first thing I'm doing is looking at his ears, and they are symmetrical. They're aligned with the outer canthus of his eyes. There is no drainage. Tell me if any of this hurts. I'm just pulling on the pretragus and the auricle. Any pain?
Nope.
So touch the other ear also. Okay. So next thing I'm going to do is use the otoscope. I'm going to change the adapter on this. And I'm going to be looking inside the external auditory canal. Okay. So I'm just going to be looking at your ear. Okay. So the ear canal is straight, there is no excessive cerumen, and there is no drainage. I am able to see the tympanic membrane, and it is a pearly gray color. There is no bulging of the membrane and no redness. Okay. And the right ear is also without any abnormality, no drainage. The tympanic membrane is a pearly gray. Now the next thing I'm going to do, I'm going to examine the patient's nose. So I'm just going to palpate, feel symmetrical. Can you tilt your head up? I'm going to look in the nares. The nares are patent. I'm going to go ahead and put this on your nose. I would be cleaning this. So, and I'm just looking at the turbinates, and the septum is not deviated, but and there is no drainage from the nose. The mucosa inside the nose is pink, and no lesions in the nose. Next thing we're going to do, we're going to look at the mouth and the pharynx. So first I'm going to inspect the patient's lips. There's no cracking. They're smooth. They're a pink color. There's no cyanosis. The next thing I'm going to do is have the patient open his mouth. Go ahead and open their mouth. I would have a gloved finger, and I would pull his lip to the side and checking his buccal mucosa. And it's smooth, pink. There's no lesions in his mouth. His teeth are intact. His gums look healthy. And go ahead and stick out your tongue. I'm going to check his gag reflex at this point with a tongue depressor, and then you would have a gag reflex that is intact. Go ahead and open your mouth again. And I'm also checking his tonsils. Good. Good. Okay, his uvula rises, and His tonsils are barely visible at a +1. He's got no cobblestoning in his throat, no redness, no drainage, no lesions. Good. And his tongue is pink, smooth, with no cracks, no lesions. Okay, so go ahead and swallow for me, Mr. Davis. Good. He's able to swallow. And I'm going to also check for the temporal mandibular joint. So, here. Go ahead and open and close your mouth a few times. Good. Good. All right. So there is no popping or cracking with that. So the TMJ is in joint and has good range of motion. So we're going to go on and look at his patient's neck. His neck, the skin is evenly colored. There's no discoloration. It is symmetrical. We're going to go ahead and check your range of motion to your neck. Can you turn to the right? Good. Turn to the left. Look up. Look down. Good. And look back up. Straight ahead. Now go ahead and turn against my hand. Good. And turn the other way. Good. So his neck has good range of motion and good strength. There's just a +5 strength to his neck. So the next thing we're going to do, we're going to go ahead and palpate the trachea. Okay. His trachea is in line. I don't feel any nodules, no abnormalities. We're going to also check the lymph nodes. So I'm going to be checking the pre-auricular nodes. In a circular motion with the pads of my fingers, we're checking the post-auricular nodes, the tonsillar nodes, the submaxillary, the submental, the superficial cervical chain, the posterior cervical chain, and then the deep cervical chain. We're also going to be palpating the supraclavicular nodes. And I don't feel any enlarged nodes. Did you have any tenderness with any of that? Okay, good. Okay, so then we're going to go ahead and we're also going to check your thyroid. So I'm going to stand behind the patient and I want you to swallow. Good. So I was able to feel the thyroid. When the patient swallowed, it moved up. This thyroid is not enlarged. It's about 3 centimeters. There are no nodules. It is smooth. Okay, so the next thing that we're going to do, we're going to check your carotid arteries. I'm going to grab a stethoscope. First thing I'm going to do, I'm going to palpate one at a time. Okay, now we're going to auscultate with the bell. Okay, I didn't hear any bruits when I auscultated his carotids, and there were no thrills when I palpated, and his carotid arteries were graded at A2 + 2. So now we're going to go ahead and check his thorax. Mr. Davis, would you mind turning around? I'm going to be checking your back. You can move that stool if we need to. That's perfect. Okay, so the first thing I'm going to do, I'm going to be inspecting his skin. I'm looking to see if there are any masses. There are no masses. There are no lesions. His posterior thorax is symmetrical. There's no dyspnea. There's no accessory muscle usage. And his AP diameter is 1 to 2. So we're going to check your spine out. I'm just looking at, look straight. I'm going to be palpating your spine. I don't feel any defects. Okay, and no abnormalities that I can feel. So what I'm going to have you do, I'm going to put my hands on your back in several places, and I'm going to have you say 99.
99, 99, 99, 99.
Good. So I was just checking for tactile fremitus, and it is not increased or decreased. So you don't see that there's any obvious consolidation there. Then I'm going to listen with my stethoscope. I'm going to have you say E every time I put my stethoscope in a spot.
E, 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 E.
Okay. at the agophony, the E still sounded like an E, so again, there didn't seem to be any consolidation or excessive air. I'm going to check for symmetrical chest expansion. So, go ahead and exhale. Good. Now inhale. Good. So his chest expanded symmetrically. My hands moved out equally and the folds went away as he breathed in. Now I'm going to go ahead and percuss your lung fields. She will listen to your lung fields first. So when you put the stethoscope on, just take a deep breath in and out through your mouth. Good. Okay, so his lung fields were clear and equal bilaterally. There were no adventitious sounds. We're going to go ahead and percuss and listen for any dullness or resonance. Okay, so all the areas were generally tympanic. The next thing we're going to do, we're going to look for the costovertebral area tenderness. So I'm going to look for the bottom of the ribs along the spine at that angle. I'm going to go ahead and ask if you have any tenderness when I tap. Anything hurt?
No.
Any pain?
No.
Okay, so if you had kidney inflammation, that could be painful. So I'm going to have you turn around, Mr. Davis, just as you were before, and I'm going to check your anterior chest. So I'm looking for the skin. I don't see any lesions. I don't see any scars that would suggest surgery. I don't see any rashes. And again, he doesn't appear to be in any dyspnea. I don't see any retractions or accessory muscle usage. So we're going to go ahead and listen again. Deep breath in and out through your mouth. Good. Okay, so his lung sounds were clear and equal bilaterally. There were no adventitious sounds. The next thing we're going to do, we're going to go ahead and check your heart tones. So I'm going to be checking with the bell and the diaphragm, and I'm going to be listening in 5 different spots. We'll be listening to the right of the sternum at the second intercostal space, that's the aortic valve. We'll also listen to the left of the sternum at the second intercostal space, that is the pulmonic area. And then the third intercostal space to the left of the sternum is Erb's point. The fourth intercostal space to the left of the sternum is the tricuspid valve. And then mid-clavicular line, fifth intercostal space, that is the tricuspid valve. So I'm going to be listening in all 4 spots while he's seated. Okay, so we're going to repeat that with the patient lying down. Can you go ahead and lay down on this bed behind you? And we'll have your head up towards the pillow. So I'm going to repeat that with both the bell and the diaphragm. So we're going to have you lie on your left side. You can do that. We're going to repeat the same process on his left side. And so far I have not heard any murmurs. We're only hearing S1 and S2 and no additional sounds. Okay, so I was able to hear S1 and S2. I did not hear any murmurs and no additional sounds. So now I'm going to feel for the point of maximal impulse. So that's going to be mid-clavicular line, fifth intercostal space. Okay, so I was able to locate his point of maximal impulse, which was approximately 2 to 3 centimeters. And I'm going to palpate the precordium in the same areas that we listened to. The aortic, pulmonic, herbs, tricuspid valve, and mitral valve. Okay. So the next thing that we're going to do is we're going to go ahead and palpate the arteries. So I already checked his carotids. So the next thing I'm going to do, I'm going to feel his radial pulses and check for symmetry. So his radial pulses are +2 and they are symmetric. We would check the femoral arteries. So can you go ahead and lay on your back again? Good. So he would be undressed for an actual exam. And okay, his femoral pulses are +2. And then we're going to feel he would have his socks and everything removed right here. Going to feel the dorsalis pedis pulses. And those are +2. Do you mind if I take off your shoes?
Yeah.
Okay. And we would have his socks removed also. So we're checking for the pedal pulses now, and they are +2, and they are symmetrical. Okay. So while we have the patient laying down, I'm going to go ahead and check his abdomen. The first thing I'm going to do is check the skin of his abdomen. There are no lesions, there are no rashes. His abdomen is symmetrical. As far as the contour, his abdomen is flat. We're going to auscultate in all 4 quadrants. So I'll be starting with the right lower quadrant and moving around clockwise. Okay, so I would be listening for a minimum of 60 seconds in each quadrant. His bell sounds were present and they were normal, active in all quadrants. So now I'm going to go ahead and I'm going to auscultate his arteries, his aortic artery, renal artery, iliac, and femoral arteries with the bell. So I'm checking the aortic artery, the renal arteries, the iliac arteries, femoral arteries. Again, that would be done without clothes on. So I did not hear any bruise in any of the arteries. They're going to percuss all 4 quadrants of the abdomen. And the sounds were tympanic in all 4 quadrants, which is what would be expected. So I'm going to palpate the 4 quadrants of the abdomen. Tell me if anything hurts. Any pain?
No.
Okay. I did not feel any masses. No pain, no tenderness, no masses noted to any of the 4 abdominal quadrants. So now we're going to do a few tests that we would do to check mainly for appendicitis. the first thing we're going to do is we're going to check McBurney's point on the right lower quadrant. Tell me if that hurts.
No.
No? Okay, then the next test we'll do Robsing sign, and that is on the left lower quadrant. So I would palpate left lower quadrant, and if it hurt on the right side, that could mean his appendix is irritated. We're going to check psoas sign. So I'm going to have you raise your right leg against my resistance. Good. Any pain?
No.
So if you have no pain, so Robsing sign is negative, then we're going to go ahead and check psoas sign. So I'm going to have you flex your right knee, and I would internally rotate the knee and hip. Any pain?
No.
Okay, so there is no pain there. The next thing we're going to do is we're going to check Murphy's sign. This would check for gallbladder inflammation. So I'm going to check under the right costal margin, and go ahead and take a deep breath. I can hit my fingers around that costal margin. Any pain or tenderness?
No.
And exhale. Good. Okay, so I'm not able to feel any masses, and there is no tenderness. And the next thing we're going to do is we're going to check the his neurological status. Can I go ahead and have you sit up again? We'll have you stay seated on this couch here. Okay. So we're going to check the cranial nerves. And the first thing that we're going to do is we are going to have you close your eyes. And I'm going to have an oil for you to smell, and just tell me what you smell.
Citrus.
And you can go ahead and open your eyes. That is cranial nerve 1, the olfactory nerve. Next we're going to check the visual fields. So we would have a Snellen chart on the wall, and we would have him read with his right eye covered, and then his left eye covered, and with both eyes uncovered. He would read the Snellen chart at 20 feet away, and then we could go ahead and assess his vision. So the next thing we're going to do, we're going to check, that would be cranial nerve number 2. We're going to also, we also checked cranial number 2 earlier. We're going to check cranial nerves 3, 4, and 6 to check the extraocular movements. We did this earlier in the assessment, but we'll do it once again. So I want you to follow my pen light with just your eyes. Good. Okay, good. So cranial nerves 3, 4, and 6 are intact, and his extraocular eye movements are normal. There is no nystagmus. Are you okay?
Yes.
Okay, good. So the next thing we're going to do is we're going to check cranial nerve number 5. We're going to check for sensation. So go ahead and close your eyes. Tell me when and where you feel the touch.
Forehead. My right cheek. Chin. Nose. Left cheek.
Okay, you can open your eyes. So cranial nerve 5 is intact. Cranial nerve 5 and number 7, I'm going to ask you to clench your teeth. Good. And then go ahead and raise your brows. Good. Puff your cheeks up with air. And smile. Good. Okay. So all those movements were normal. Can you go ahead and stick out your tongue? Okay, excellent. Now the next thing we're going to do is cranial nerve number 7, the acoustic nerve. And we're going to do the Weber and Wren test. So I'm going to strike this, I'm going to put it on top of your head, and I want you to tell me if you hear the sound louder in your right ear, your left ear, or if it's even.
They're the same.
Okay, good. Now we're going to do the Wren test, and I want you to tell me when you hear the sound and when you no longer hear the sound.
I can hear it. Now I can't.
Okay, now?
I can hear it. Now I can't.
Good. Okay, so we would also do that on his left ear. And the air conduction is greater than bone conduction, so that's what we would expect in this test. So the next thing we do, we would check your gag reflex. We actually did that earlier. This is cranial nerve number 9 and number 10. So I'd have you stick out your tongue and say ah, and I would press on this. The gag and his uvula would rise up and would be intact. Can you swallow one more time? He's able to swallow. Okay. So cranial nerve 9 and 10 are intact. The next thing we're going to do is cranial nerve number 11. We're going to have him shrug your shoulders against my hands. Good. So he has equal strength, symmetrical cranial nerve. Number 11 is intact. Cranial number 12, the glossopharyngeal nerve, assesses a tongue movement. Can you go ahead and stick out your tongue and lift your tongue up, down, side to side. Good. Okay, and then I want you to repeat these sounds after me. L,
L,
T,
T,
N.
N.
Okay, good. And swallow again. Okay, very good. So cranial nerve number 12 is intact. Now we're going to move on to part 2 of the neurological exam. I'm going to have you stand up for me, Mr. Davis. So right now I am looking at his balance, and I don't see any excessive swaying. He's maintaining his balance. Can you close your eyes? I'm going to stand near the patient, and I am also observing for any swaying and loss of balance. You can open your eyes. So he didn't have any excessive swaying or loss of balance. Now the next thing I'm going to do, if you could come over here, and I'm just going to have you walk to that side of the room. Good. So his gait is normal, and I want you to turn around, and I want you to walk heel to toe in a straight line, like one heel in front of your toe, just like that.
Okay.
Okay, and just walk toward me. Okay, that's good. Okay, you can go ahead and relax. The next thing we're going to do is we are going to have you touch your nose with your finger of your right hand. Now your left hand. And do it again. Okay, good. The next thing we want you to do is I want you to take your palms and I want you to touch your thumb with the first finger, second finger, third, fourth, and then repeat. Just keep doing it. Good. And you can go back either direction. Good. Good. Okay, that's good. Okay, so the next thing I'm going to do, you can go ahead and sit down now. I'm going to check your grip strength. So go ahead and grab my fingers, squeeze. Good. His grip strength is even and symmetrical. So the next thing we're going to do, we're going to check his stereognosis. So I'm going to grab a couple items, and I want you to close your eyes. I'm going to put an object in your hand, and I want you to tell me what it is. Put your palms up, close your palm around the object. Can you tell me what is in your palm?
Paperclip.
Good. Keep your eyes closed. Let me see your other palm. Close your hand around the object. And tell me what you feel.
Coin.
Yes. Very good. The next thing we're going to do is, you can keep your eyes closed now. I'm going to draw a shape on your palm, and I want you to tell me what it is.
Circle.
Yeah, very good. And on this one?
Figure 8.
Yeah, very good. You can go ahead and open your eyes. Now I want you to repeat a phrase after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Very good. So we're assessing his speech with that. It's clear. He's able to understand me. He's coherent. And the next thing I'm going to do, I'm going to have you take your heel of your right leg and then run it down your left shin. You can stand up if that makes it easier. I think that would be a lot easier. Okay.
Right heel.
Yep, right heel against your left shin. Good. Good. And then the next one, left heel against your right shin. Okay. Excellent. Then the next thing I want you to do, I'm going to have you push against my hands. I'll have you turn this way so they can see. Go ahead and push against my hands. Good. And then I want you to pull my hands toward you. Okay, good. So we're checking the rebound phenomenon. So that was intact. Didn't mean to surprise you. The next thing we're going to do, we're going to check the Babinski's reflex. So I'm going to have you lay down again with your feet toward me. I may need to remove your sock, but we'll see. So I'm going to check the Babinski's reflex on him. I'm going to be moving my fingertip along the lateral side of his foot towards the inside. Let me take your sock off. It's going to make it a little bit easier. Do you mind if I take your socks off? We're going to have to do a few other tests with them off. Good. Okay. So his Babinski is negative, which is what we would expect in somebody over 24 months of age. The next thing we're going to do is we're going to check the deep tendon reflexes. Okay, could you go ahead and sit up for me once again? So we're going to start off by checking the brachial. So let me have your arms. Go ahead and rest it. Good. Can you see this one? Good. Then we're going to check the brachioradial. Good. Good. Ready to check the triceps? So you just kind of dangle your arm, or try to relax it if you can. Good. Okay, good. Excellent. And then we're going to also, we would check the, we would have them probably laying down for this, it would be easier. We would check behind, we check the Achilles reflex. Good. Or his feet would be dangling, that would also make it a lot easier. So his, let's check the patellar also. Alright, so again, as his deep tendon reflexes are intact, and they are +2. And the next thing that we're going to do is we're going to do the musculoskeletal exam. And I would have his legs exposed, and obviously his arms are exposed. So when I'm checking, I'm going to check the extremities. I'm going to compare the right to the left. I'm looking for any asymmetry. I'm also checking the skin color as we go. There's no cyanosis, no rashes, no lesions. And I'm going to palpate the joints, and I'm palpating for any edema and any pain. Do you have any pain with that?
No.
So then I'm going to check the capillary refill on both hands. The capillary refill is brisk, and it is less than 2 seconds. There is no joint swelling in his upper extremities. We're going to also assess his lower extremities. We would assess the skin color. We would assess the hair distribution to his lower legs, look for any vascular signs of disease. And I would also palpate, checking for any asymmetry, any swelling. I'm also checking the capillary refill of his toes, and it is also brisk at less than 2 seconds. So the next thing we're going to do is we're going to check the range of motion to his joints. So I want you to go ahead and lift your arms up, good, and then lower them. And then I'm going to have you lift them out to the sides, bring them in and cross in front of you. Good. Okay, and then I want you to flip your wrists up, down, put your thumbs in toward each other like this. Kind of angle your fingers in and angle them out. And then turn your wrists in a circle and out. So we're checking, that's good. We're checking abduction, flexion, and extension, and rotation of all the joints. I want you to go ahead and flex your arms up and extend, and then down. Good. Okay, so I'm going to check his muscular strength. I'm going to put my hands on your wrist and go ahead and pull your arms up like a biceps curl. Good. Then press down. Good. And then take your arms out to the side. And then I want you to press up. Good. Press down. Very good. Okay, so his muscular strength is a +5 to his biceps, triceps, and his shoulders. So we're also going to check his lower extremity range of motion. So I would have him lay down, would probably be easier for this. You can actually just lean back. We can do this if you lean back on this for now. So what I'm going to do is I would have you have your legs out, and then I'd have you close your legs together. Good. And then open your legs out, close your legs together. And that's checking for abduction of the hips. We could also have him cross a leg over like a scissor, and then cross them back like that. And so, yeah, you can go ahead and relax your legs now. So that's just checking for abduction and adduction. Then I want you to go ahead and lift your knees up towards the ceiling. Good. So he has good strength. And then go ahead and press against my hands like you're lifting your feet up. And then pull down. Good. And then push against my hands. Good. And pull back. Good. Okay, so I want you to go ahead and bring your legs out, both of them. Good. Take them down again. Okay, that's good. So his adduction and abduction is good range of motion to his hips, his knees, and his ankles. Can we go ahead and have you stand up now? I'm going to check your spinal range of motion. Okay, so I want you to bend over. Good, and I'd be looking for any asymmetry, Good. You can go ahead and straighten up now. And I want you to rotate toward me. Just keep your hips straight, like keep looking forward. And I want you to rotate like your shoulders only toward me. Good. And then look the other way. Turn your head right the other way. I'm sorry. That's good. And then go straight forward. Okay. So he has good spinal range of motion. I want you to go ahead and bend forward. Flexion and then stand up. Then I want you to lean back all the way. Good. Okay, good. So he has good range of motion, flexion and extension. Now, I'm going to go ahead and I'm going to have you lay down one more time. We have to do one more test for your knees. So this is the anterior drawer test. I'm going to have you go ahead and put your knees on the couch. Perfect. And palpating the patella. And I'm going to put my fingers at the patella, my hands behind the knee, and I'm going to move your tibia forward. Good. And I'm going to do that on the right leg. Okay, good. And there is no excessive movement on that, so that would check for ACL tears. So it looks like we're done with the assessment. You can go ahead and sit up again, Mr. Davis. And I think that completes our exam. Thank you very much.
Welcome.